We're now in year 6 of this show. A lot of help with James Lott Jr. I'm James Lott Jr., here to help, of course. And I've had a chance to have a lot of guests on my show. And because I've been on for so long, I have returning guests. And this person was on literally nearly a year ago. Just the timing, he reached out to me and we put together, I didn't even know until I looked like, wait a minute, he was on in last February, 2023. And we had a great conversation. I told him I wanted him back anytime. So I have him back today. He has helptheaddictedchild.com. He spent 11 years working as an addictions counselor at the Menninger Clinic in Houston, Texas, before retiring in 2019. But he's so passionate about still trying to help our teens and substance abuse. When I say substance abuse, we're not just talking drinking, we're also talking drugs, vaping, anything that nature. We're going to continue talking about this because we were talking about the last time about the pandemic stuff, pre-pandemic stuff. Now we're going to talk. He has some upcoming findings, and we're going to update and see what's going on with him. So I want you to help me welcome Richard Capriola. Hi, Richard.
Thanks, James. Hello. It's a pleasure to be back with you. To be on this program with you. Congratulations on 6 years of producing and being the star of this show. That's quite an accomplishment, and it's just a pleasure to be back with you.
Yeah, we had a great time last night. And I told you, it's fun anytime. I love it. But again, teens. I mean, that's those are the folks after us. I mean, I have grandchildren who are teens. I think teens are important, and I always want to look out for them and anyone who is taking care of teens, raising teens, guardians of teens, so they know what's going on, because substance abuse happens through the teens. It doesn't just happen when you're an adult. And we had a pandemic. I mean, I guess it's over. Is it over? Is it endemic? I don't know what is the. Do you know the term, or what is it right now we're in?
Right. Officially, I think we're out of a pandemic, but that doesn't mean that the virus isn't still out there or that people aren't affected by it. But now we have effective vaccines that help protect us. So I don't think it's as devastating as it was when it first came on site.
Yeah. Now the work that you do, I'll make sure to give people context of the work that you do. It's from like 10th to 12th graders. Like, can you explain who are the subjects that you actually kind of look after and look at?
Yeah, this is a survey that's done every year by the University of Michigan. It's called Monitoring the Future. And they survey some 20,000 students in 8th, 10th, and 12th grade every year. And what they're looking for is information on what substances are you using, how often do you use these substances, how dangerous do you think these substances are, and how easy is it for you to get these substances. And then they compile all this information into an annual report so that we can see how the trends are going with these young men and women through a period of time.
And we're going to talk about this report. And I want to mention, folks at home, we're talking alcohol, beer, alcohol with caffeine. I thought that was very interesting. I'll ask you about that in a second. Flavored alcohol beverages, of course. Marijuana vaping, flavored. I can't get the word out. Flavored vaping. That's sometimes fast.
Yeah.
Nicotine vaping. There is differences. I'm going to ask you about that too. Delta 8 cigarettes, the good old fashioned cigarettes, inhalants, hallucinogenics, then other drugs like ecstasy, cocaine, crack, heroin. Then, things like Vicodin, Ritalin, Adderall, cough medicine, energy drinks. I mean, and then we're going to talk about the thing that's really getting everyone, is just fentanyl. I'll talk that too with you. Actually, I want to start with that first, just because there's a I follow a page on Instagram called Every 11 Seconds. I don't know if you've heard of them. And they post like videos of mostly young people who have died from fentanyl.
Yeah.
Usually it's their pictures, last videos, and it's like, these happy, looking children, basically. To me, they're children at this point. I'm old now, so they're all children. And literally showing them, and then they're like, they died from a fentanyl overdose. They died from it. So fentanyl has gotten, the last few years has really gone up, hasn't it?
It has, at an alarming rate. And fentanyl is a very powerful drug. I think I noted in some of the material that I sent out that it's a synthetic opiate, very similar to morphine, but it's 50 times stronger than heroin and 100 times stronger than morphine. So it's a very powerful drug. And unfortunately, many people throughout this country, adults primarily, are dying from an overdose of fentanyl. The danger, I think, that parents and teenagers need to be aware of is that many times this fentanyl is laced in with other drugs. So while the teenager may not be looking for fentanyl, it may be laced into some of the drugs that they pick up off the street, and that often leads to an overdose and unfortunately some deaths. So the danger is not that our teenagers are out looking for fentanyl. The adults are not necessarily looking for fentanyl, but the overdoses and the deaths come about because the fentanyl is laced in with other drugs that they're seeking, and then they overdose. And unfortunately, too many of them are dying. But it is becoming an epidemic in our country.
Now, you mentioned something very important. So, as you're doing this study, if fentanyl's being mixed with some other drugs, some of these other drugs, how does that affect the study? How do you separate the fentanyl usage compared to the others?
Well, it doesn't really affect the study because we don't know which particular drugs kids are taking that are being laced,
Okay.
based upon the percentages of kids that are ending up in the hospital or unfortunately dying because of fentanyl. The rates are not extremely high, which tells us that the majority of drugs that kids are picking up on the street are not laced with fentanyl.
Okay.
But what parents need to be aware of is that anytime a person, a kid, an adult is picking up a drug off the street, there is that danger, even if it's slight, that that drug might be laced with fentanyl.
Got it. Got it. So just keep an eye out if that could be something because in the study that's kind of like the note. It's like there's like a kind of a thing afterwards of like I want to make sure to talk about that first because I just know that it's a big deal.
Yeah,
Big deal out there for everyone, folks, not just for teens, but for everybody. But if you have teens, I tell you, it's probably every 11 seconds. It's really interesting. It's sad to watch, but
it is.
see how young these people are, and it's like wow. And I've had morphine when I was in the hospital. That I almost cussed. That S is strong. It's strong, and you can get
Yeah,
like, and when you're in pain and it takes it away, your brain does get altered. I mean, it does. That Norco, things like that. I'm like, I can't take that stuff anymore because it's just too much for me. But I want to
yeah,
mention something that's very interesting in this study. A study also, it's cold and cough medicine. So
yes.
I have something to share with you, Richard Capriola. I do.
Okay.
I got addicted to NyQuil and Dayquil. And I had
Yeah,
to have an intervention. Literally, my friends came together and were like, James, you're drinking it like it's juice. I took it for being sick, and then I liked the feeling of not being sick, and then I wasn't sick anymore. I kept drinking with that
yeah,
little cup. So we always have jokes about it, but it's kind of like but for real. This is in the study. It's part of the study. So I tell people all the time. I go, yes, in large doses, you can get hallucinogenic. So talk about that one because that's a household item, and a lot of we're in flu season, we're in cold season. Can you talk about that a little bit? In your
well, I think you did a great job of explaining the effects that it can have on a person, and really why they are attracted to it so much is that feeling that they get from taking so much of it. They're not taking it as prescribed. They're mixing it in and they're taking large quantities of it. And that brings up a good point too, James, in that parents need to understand that no matter what medicines they have at home, like over-the-counter cough medicine, over-the-counter any type of drugs, and certainly all their prescription drugs, they need to secure those drugs to keep them away from their kids. Even alcohol, if you have alcohol at home, make sure it's secure because these kids have too easy access to these drugs at home. So if you have some cough syrup, maybe laying around from a time when you had a cold, it's available to these kids, and they will use it. Sometimes they'll take that cough medicine and they'll mix it with a soda, a 7-Up or a Sprite, and drink large quantities of it to get the feeling that you very well just described and how it makes them feel. Makes them feel really good.
I just probably like in 2023. I mean, 4% of students in eighth grade, 3% in 10th, almost 3% in 12th. Like that's a low percentage. I mean, there's some folks who are using them. It's like it seems so
Yeah,
benign, right? It's like it's cough medicine. It's like makes you feel better, right? Like
and
I thought it seemed like
that's one of the things parents wouldn't even think about that their kids would
oh
get into. Well, why in the hell would they drink cough syrup? That makes
yeah.
sense. But yeah, they do.
That's why I brought that up because I want people. Somebody this notice. I read the study, so he gave me the whole study, folks. You know me, I read everything. And I read it. I was like, there are certain points I want to bring up because I thought that's really interesting. It's like you don't know about that, and also energy drinks. I can't do energy
Yes,
drinks. I can't do them. They're just too
me
much,
either.
you know. So let's talk about that because we're talking 17 in 2023, 17, 18%. That's a
Hmm.
chunk of kids. And I know kids who drink monster drinks and this drink and that. All the time. So talk about
Yep.
that, please.
Yeah, that's becoming a little bit alarming too. Is the percentages of these kids that are getting these energy drinks, and again, they're easy to get. You could walk into any store
Yeah.
and get them. But they contain a lot of stimulants, and kids are getting the rush from that. We need to keep an eye on that to see how that progresses. But definitely, it's a concern. And again, it's one of these things that parents just don't think about. You don't think about your kid drinking a lot of energy drinks. They may drink one, but you don't know how many more they're drinking. So just again, a lot of this is being aware of what's going on, and just understanding that these things are out there, and they're becoming very popular with teenagers. These energy drinks is one of the categories.
Yeah. The 5 hour, the Red Bull, all that stuff. Yeah. It's
Yeah.
something else. Now, here's what I want your opinion on because I don't know how you handle this part. But on the study, there's Ritalin, Adderall, and other ADHD stimulant stuff. Okay, so a lot of those things are used to treat a condition, usually a brain condition. So and
Hmm.
and again, we're talking 8%. There's some low. So other ones are kind of low. They're like 1%, they're like 5%, 1%. But still, how can you even handle that? It's because they're taking it for something. I don't know how you can handle that. How you can contain that.
Well, for example, the one on Ritalin,
Yes.
which is a stimulant, as you noticed that you noted is used to treat ADHD. The percentages that we see there are use of Ritalin without a doctor's prescription. This is non-prescribed use of Ritalin. This is Ritalin that they're getting off the street or they're getting from their friends. So, the prevalence has declined substantially,
Yes. At the
but
same time.
still, it's 3% of eighth graders, 5% of 10th graders, and 5% of 12th graders are using Ritalin without a prescription. So that's just an indication, once again, that kids have easy access to these drugs. When we ask them in the survey, how easy is it for you to get drugs, like marijuana, for example? They tell us, no big deal. It's no big deal. We can get them if we want them. How easy is it to get alcohol? No, that's easy to get. No problem there. How easy is it to get any of these drugs? Not too tough. We can get them if we want them. And then we ask them, okay, so you say it's easy to get these substances. How dangerous do you think they are? And overwhelmingly, they tell us, we don't think they're dangerous. We don't think smoking marijuana 3, 4, 5 times a week, we don't think that's dangerous. We don't think these drugs are dangerous. So when you take the two, availability, they're widely available, these drugs, and kids know it, and they don't think they're dangerous. You have a perfect environment for the substance use that we see out there.
Well, it's true because I'm from California and I'm out here, and of course, marijuana is legal out here and stuff, and all the services. But I noticed when I was younger, until you saw someone actually OD in front of you, and you're young, you don't think it's dangerous. So like, yeah, sure. Back in your mind, you hear that stuff. So it's
Yeah,
funny to hear that teenagers today still think the same way. It's like until it's right in front of them, and they see someone code out.
yeah.
They're like, "Oh, it's fine. It's just weed." That's what I mean. Like that's the whole thing, right? It's like it's so interesting, isn't it?
Well, yeah, it's not going to happen to me.
Right,
I don't know anybody it's happened to. What are
right.
the chances it's going to happen? And marijuana is legal for adults, so how can it be so bad? The government says it's okay for adults. Well, the missing factor in there is that the adolescent brain is very very vulnerable, much more so than the adult brain. So while smoking marijuana for an adult might not be too dangerous, smoking an adolescent smoking marijuana runs some real risk to making changes and doing some damage to their developing brain.
Um, that's true. The one that got me gasping a little bit, clutching collective pearls. I was like, the vaping numbers. Wow,
Yeah,
we're talking 11, 18% nicotine vaping, 23%.
yeah,
We're talking marijuana vaping, 20%. I mean, like, it's and the flavored vaping, which I know a lot of people do that, 20%, 10%. Like, it's like, wow, it's really
yes.
going up.
And
Uh,
what we noticed from the statistics from the study was that 3 years prior to the pandemic, for 3 years prior to the pandemic, the percentages of kids that were vaping marijuana and vaping nicotine was increasing at dramatic rates every single year until the pandemic. Then the pandemic comes along and everything shuts down. And drug abuse among teens during the pandemic nosedived, went really low.
which we talked about
Now
last
it's
time. Yeah,
starting
talked about last time. Yeah.
now it's starting to rebound and pick up a little bit. But there's no question that this issue of vaping nicotine, vaping marijuana is becoming widespread within the adolescent community, and it's an alarming rate. Parents need to be aware that this vaping issue is out there, and that it is at rather alarming rates among teenagers. Now, smoking cigarettes, on the other hand, is at an all-time low
I saw
because
that. Yes.
kids have moved away from getting their nicotine through smoking cigarettes, and now they get it through vaping nicotine. Um, and 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 the problem with that is that when they vape nicotine, they're getting higher concentrations of nicotine than what they would get through smoking, say, cigarettes. But nicotine and marijuana vaping, it's a big issue out there that parents need to be aware of. And many times parents and teachers, they don't even know that these kids are vaping because the vaping instruments, the vaping pens, they're small, they can be concealed, you can carry them in a pocket, you can take them to school, you can go into the restroom and take a few hits, and nobody knows.
Yeah. I'm like, when I was a teenager, we didn't have all this easy stuff. You had to roll the joints, that kind of thing. And I'm being funny on purpose because it's kind of like because things are changing, and on some level things are changing, and it is. And the
Yeah.
point I'm trying to make is that folks at home, it's a serious thing because the vessels they're using, the way it's all now really secretive. It's like it's so easy. In the old days, you had to go somewhere, roll the joint. You smoke, they get I guess there's so many
Yeah.
cigarettes. You got to go smoke the cigarettes and smoke it. Like it's a very different. I remember when e-cigarettes first came out. That was the first thing. That was the first step. And I just think it's funny with the kids and stuff. Um, I wonder what the study says about this, if they took this into account, because the pandemic does it take into? I should ask. Let me ask the question this way: does this study take into account a lot of kids were at home, and maybe that's why
Absolutely.
and that's why it went. Some things went down because they were at home, the parents.
Absolutely, absolutely. You're right on target with that one, James. I think the reason we saw the substantial decline in substance abuse across the board among adolescents was during that year when everything was shut down. They weren't going to school. They were doing homeschooling. They were pulled away from their peers. They were pulled away from their sports activities and their social activities. So that was a big factor in the decline of substance use across the board, was during that 1 year when the pandemic was really bad and things were shut down. We've noticed that since the pandemic, we're still not back to pre-pandemic levels on most of these drugs, with the exception of alcohol. Alcohol has come back to the pre-pandemic level,
We're gonna talk
but
about
the
that. I want to talk about that. Yes.
but the other drugs, the marijuana, the prescription drug abuse, and some of these others, they've not gotten back to the pre-pandemic levels, which is a good thing. But alcohol has managed to get back to pretty much where it was before the pandemic.
I know this is not in the study, but for you just personally, the person who's done this for years, stuff, what are some of your thoughts about that? Do you think it's because now we're back socializing again, now we're back in the world, we're not sitting at home scared and frustrated and angry and fearful? Like, do you feel like that's a reason why some things are declining, you think? Or what do you think?
Well, I think there was an impact among kids who were in ninth grade during that pandemic year when everything went down. And I think the fact that they were pulled away for an entire year from access to drugs, we're now seeing some of that in the post-pandemic era. In other words, I think the effect of the pandemic and what it did to reduce substance abuse, particularly among ninth graders, has had a lasting effect. And as they went from ninth to 10th to 11th to 12th grade, perhaps being sheltered away and not having as much access to drugs during ninth grade has had an impact, a positive impact. So now that they get to the higher grades, we're not seeing the levels that we used to be. So it could be that the pandemic had not only an immediate effect of reducing substance abuse among teens, it may have had a longer lasting effect that might even carry into adulthood, which would be a very positive result of the pandemic.
Does the study take consideration at all schoolwork levels, getting ready for college as you get old, as you get to higher grades? I mean, is there anything, more responsibility? Is there anything, and they take that, is that are part of the questions at all, or
No, they don't look at that. They're just
okay?
looking at, they're basically focusing in on the extent of use and kids' perceptions and attitudes about these drugs.
Well, actually, I should have you do this. Kind of explain, you explain what the study from the University of Wisconsin, but kind of explain the structure of the study, kind of, if you can, for
Yeah,
folks.
the study looks at 20 some thousand students across the country in in the three grade levels that we talked about, the eighth grade, the 10th grade, and the 12th grade. It's a random sample. Parents are told about the study. They
Okay.
actually have to approve their child's participation in the study. It's all done electronically. Now in the age of computers, they can sit at a computer and answer all these questions. And then there's a statistic sampling of how it's put together. And then the results are put together into an annual study. It's called Monitoring the Future, sponsored by the University of Michigan, the National Institute of Drug Abuse, and it's been a study that's been going on for, I think, 20, 30 years. So they've got an entire history of data on these kids.
And the subjects, it's all anonymous or all protected.
It is anonymous. Like I say, the parents have to sign off and approve their child participating in
Yeah.
the program. It's all done by computer. There is no identification of
Okay.
who these kids are, or any way of being able to identify them.
So I know it's alcohol. So I know that alcohol is. I'm looking at a study and it's gone down, but it's still high lump numbers to me. 42%,
Yeah.
46%, 31%, 30, 15%. It's still high to me. I have a cousin who just was killed by a drunk driver last week, a young drunk
Oh
driver.
my gosh.
Yes, and he was young himself. Left a fiance and kids behind. The driver was young themselves. I don't know how young exactly, but it was not. It was young. And
Hmm.
I just think, and thank you. It was horrible, and shout out to Q and everything. And we had a funeral this week. Um,
Oh my gosh.
but my thing is, I almost forgot that out because everything else in the study, I see it. I'm so aware of it. I almost forget about beer and alcohol for kids. Like I almost forget that's still a problem. And yes, it's going down. Those numbers still scare the s out of me. They still scare me. And we mentioned alcohol beverages with caffeine. I forgot there are those things too. So anyway,
Yeah.
what can you talk about that subject on that?
Well, my condolences on that tragedy.
Thank you,
That's horrible. And
thank you.
every time we hear of situations like this where young people are injured or lose their life because of alcohol or driving under the influence, it just drives home the importance of how dangerous these drugs can be. For adults, driving under the influence, adolescents having access to alcohol at an age when they're able to drive, I think raises the level of risk. Um, it's not something that parents should become paranoid about. I want them to fear that their kid is going to meet with that consequence. Although I think as a parent, that's always a fear that's in the back of your head when your kid starts to drive a car. Um, but it does point out the dangers that such a widely available substance like alcohol is in our society, and the dangers that it poses, particularly for these young men and women.
I'm thinking as we're looking at say it's gone down. I'm assuming again because at home, but you said earlier, alcohol could be there
Yeah.
because in the household it's easy to get to. So I'm assuming that. But I never thought of alcohol with caffeine. I forgot there are products out there that do both. They kind of like, and I've had one of those products once, and I was confused. My brain was confused. Like I'm awake and I can't blink. Yeah, I'm feeling buzzed at the same time. Like I did it once, and I was like, I'm done. That was kind of weird. Yeah, that was crazy. I had a coffee martini once too. Like a coffee martini. No, that's too. I
Oh,
like my coffee. I like my martinis. Totally separate. I can't do them together. So
don't mix them together. Yeah.
they'll mix them together. But see, to the kids, I'm still disturbed by some of these. I want these numbers to go way down. I love them to continue to go
Yeah.
down because it's just kind of crazy. Same thing with flavored alcoholic beverages. I know White Claw is like the new thing right now, and Mike's Hard Lemonade is still big, and all that stuff. And
Yeah.
his study is like saying it's like even though I guess it's lowering, it said it went back up a little bit, then it went back down again. It's still close. It's like between 36 and 38%. That's only 2% down. That's not a lot.
Well, and it just points out that alcohol and marijuana are two of the most popular substances among the teenage population, and it's been that way for a long, long time.
Yes.
And it's not changing dramatically, but alcohol and marijuana, those are the two substances that they like. And I would throw in now vaping. So you take alcohol, marijuana, and vaping, and those are the three big ones.
And I think about that if they had vaping when I was a teenager, back in the 80s. I was like, I just wonder what that would have been like. I mean, I will admit, I had my first cigarette at 16. I
Yeah.
had a Newport. That was my first. Like someone said, have a cigarette. I said, I'll try it. I wanted fancy or whatever. And I tried it, and I did smoke off and on for about 20 years. And then I stopped finally, and I noticed here in California we have a lot less smokers. I hardly ever see anybody smoking cigarettes. Vaping's one thing, but smoking cigarettes, I hardly see. And when I see somebody outside, 'cause I used to work in retail, I used to work in food service. You take a break and you smoke a cigarette on your break.
Yeah.
I rarely see that anymore. But I guess they
Well,
move.
I think that even among adults, they have moved away from
Um,
smoking tobacco to vaping nicotine. It's much easier. It has the advantages of being easily available, and it's portable, and you don't have to light up and blow out a lot of smoke and annoy people. You can just casually vape. Um,
yeah.
but I think it's the same for adults. They've moved away from nicotine through smoking to nicotine through vaping.
So we have the study. It's our second time talking about the study. It's updated. As we kind of summarize this, how do you summarize this for people? You gave some good advice, like saying watch your kid, things like that. But like, how do we, with these numbers, we gotta look out for certain things, obviously. But like, how do you summarize this for folks or
I
parents?
summarize this as it's still a problem among the adolescent population. And if you are a parent or a grandparent of a preteen or a teen, the best thing that you can do is to be aware of what's going on out there, be aware of what some of these substances are, and learn the warning signs that I have in my book, which is The Addicted Child, A Parent's Guide to Adolescent Substance Abuse. Become knowledgeable. Knowledge is power. Don't become paranoid about this issue, but become knowledgeable about it, knowing that if you are confronted with this as a parent or a grandparent, you feel better prepared and better informed to deal with this. And I think that's the best that any parent or grandparent can do, is just be prepared, be knowledgeable, and hopefully that'll help you feel less paranoid and more confident that you're able to handle this situation if it arises. You hope it never does, but you don't want to be one of these parents that gets blindsided and find out, that their kid had been involved in alcohol or drugs for some time and you knew nothing about it. Because believe me, that happens all too frequently, where
Oh, sure.
parents will say to me, I had no idea this was going on. Or they would say, well, I knew something was going on, but I didn't think it was this bad. Well, yeah, now it's this bad.
Yes, that's true. Richard, thank you so much. Of course, the next time another study comes out, you got to come back on again. Next time the study keeps updating, you have to come back. All right, this will be a little mini series. Every time it happens, it gets updated. We got to talk about it. How's that sound?
Well, we certainly will. Thank you, James. I really appreciate you taking the time to speak with me and add your thoughts and wisdom to this discussion as well, which was very valuable. So thank you once again.
Thank you. HelpTheAddictedChild.com. Go there. That's where you can find his book and services and all kinds of goodies over there. And so check that out. It's Richard Capriola. I'm James Lott Jr., of course, a lot of help.com, a lot of help on Facebook, and James Lott Jr. everywhere else. You can just Google me, you'll find me. I'm everywhere. And we will see you next time.